Hello, everyone. Thank you guys again. Sorry we're running a few minutes behind. You know, this is life. And so I'm Dr. Jess Daigle. I'm a board certified pediatrician, NICU hospitalist, and founder of Mom and Me by Jess Daigle MD, an in-home virtual and postpartum care service that's going to take care of mamas and their babies after they have delivered. And the goal is to help moms and their babies transition home after delivery. As you moms out there know, that time is fraught with overwhelm, anxiety, and a lot of I don't know, and what's going on with this baby, and why do they make those noises, and why do they look like that? All these questions. So I want to be there as a resource to help my moms take a sigh of relief and realize, hey, many moms have done it before and many will do it after you, and that means you can do it too. And so one of those topics or things, as I've alluded to in my post, is sneezing or concern for allergies in babies for different reasons. One, sneezing. A mom will be like, hey, does my baby have allergies? Because they started sneezing like day of life one, and the family may have allergies to different things. So they're wondering, have they passed these on to their babies? Two, when they're starting to eat, if they break out into a rash or they don't seem to be tolerating the milk or the formula, they're like, hey, does this mean my baby have an allergy? So I thought, why not bring the experts on board? Dr. Karen Kaufman. She is my MD Business School sister and a fabulous expert. I've already sidelined her for a couple of things over the last couple of months, and she's been so gracious. But I thought, why not let her loose to the public and let us learn from her so we can be assured that our babies are okay. And if we need to seek help, we know where to go. So thank you, Karen Kaufman, Dr. Karen Kaufman, so much for coming on today.
Thank you so much. This is going to be so fun because I will tell you, 9 years ago when I was a brand new mom for the first time, I could have used your services because overwhelm was, such a, common feeling amongst new moms, and I sure did feel it myself. So I am really hopeful today that our little conversation is going to be helpful to some new moms out there, or even some seasoned moms when these questions come up for the first time, for sure.
Yeah, so tell us a little bit about you, where you are in your practice.
Sure. So my name is Karen Kaufman, and I am a double board certified allergist, immunologist, and internal medicine physician. And I practice clinical allergy and immunology for children and adults. And I help families and children and adults with infections and allergies to feel better on fewer medications and improve that quality of life that they deserve. And I have a private practice called Kaufman Allergy, Asthma, and Immunology, and we are located in the Northern Virginia suburbs of Vienna, Virginia, which is right outside of Washington, D.C. And so anyways, I'm thrilled to be here, so thank you so much for having me.
Oh yeah, I'm so excited for this discussion. When I posted it, I had some moms like, "Ooh, this is a good one." So explain to people, what exactly is an allergic reaction? Like, what does that mean when someone is like, hey, I had an allergic reaction? Because we know a lot of times people will sometimes toss that term around, and I really want my listeners and my moms and them to understand what's really happening in the body when we are saying, hey, there's an allergic reaction going on.
Sure. And you're right. I think that that's a common phrase that gets thrown around to a lot of things that not all of them actually fit. But what's really happening in the setting of allergy is that it's an issue with our immune systems, which are meant to keep us healthy, where our immune systems start to make specific types of IgE antibodies. That's the name of the antibodies that are present in the setting of allergy. And they are targeting different types of triggers, which are things external to us that we can become reactive to. So for example, in the setting of food allergy, in the setting of environmental allergy, we are making IgE antibodies specific to whatever that offending agent is. So whether it's milk or whether it's the cat or whatever, that's when we start to become reactive. So when we develop allergy, we first develop sensitization, which is the time of our initial exposure, and then reactivity comes on subsequent exposure. So that's pretty typical. And our IgE mediated allergies manifest as immediate hypersensitivity. So typically symptom onset is going to be within maybe seconds to minutes to an hour of our exposure. And that's really what we see in the setting of, for the most part, in true allergy. And allergy, in the setting of food reactivity can look a couple of different ways. And we'll talk a little bit about this during our chat, I think today, but we talk about immediate hypersensitivity. And in infants, sometimes we are talking about, food allergy that drives eczema. So I think that's something that's worthwhile to talk about too, because these are some of the things that may pop up in that first year of life. And then environmental allergies, I think in the newborn period and in infants, may develop to some of our indoor allergens that we have regular exposure to at home, but the outdoor environmental allergens really start later.
Okay, thank you so much. That's so helpful.
That's a little tidbit, a little start.
That's great, actually. That's great. And so one of the questions that often comes up are, can babies be born with allergies the same as their parents? So sometimes, somebody will be like, hey, I was allergic to that antibiotic. Will my baby be allergic to that antibiotic? Or I can't drink milk. Will my baby have a tolerance to it? So what do you tell a family that has that kind of question?
Sure, those are great questions. So, I will definitely say for children of parents who have environmental allergies, parents who have asthma, parents who have food allergies, there is a higher likelihood that your child will develop allergies at some point in time, but it's not a single gene defect. So it's not like mom has an allergy to cat and therefore the baby's allergic to cat. It doesn't pass along that way, but the likelihood in general of the development of allergy is higher for those type of allergens. However, for drug allergy, doesn't work that way. So things like penicillin allergy, especially, which is, it's just super, super common that's a highly reported, drug allergy. We find that, it doesn't run in families, but sometimes multiple family members may have it just because it's commonly reported. Commonly reported is different than actually common occurrence. So that's a whole separate sideline discussion. But yeah, I wouldn't be afraid, if a child needs antibiotics for management, let's say of a, ear infection or something like that, I wouldn't be hesitant to use an antibiotic in the penicillin family in a child who has a parent with penicillin allergy. It doesn't pass through like that. It doesn't run genetically.
That's good. That's very helpful, especially for me, because, sometimes I used to find when I was in a pediatric clinic and you're trying to find yourself trying to reassure these families. Sure. And they're looking at you like, I don't know if I believe you, or they're just really afraid, and then you often wonder yourself too. Allergy and immunology has always been one of those fields that are fascinating and intimidating, kind of like the kidney for me. But it's so important and it kind of affects everything, but it's so intricate. I think it's so fascinating just how some people can be allergic to peanuts and other people aren't. That's amazing to me. What is it about them and the peanuts that just doesn't go together, And so all of that is definitely very interesting and very helpful. And so how does a mom, especially people who are breastfeeding their babies, moms are eating things that are transferring into their milk. And so sometimes the first sign of distress is they either break out in a rash, eczema, like you mentioned earlier, or they may seem to be vomiting, which I even in one of my posts says a little bit more questions we have to ask to kind of tease out. Are we worried about, say, that difference between lactose intolerance versus an allergy to cow's milk protein? So could you explain a little bit more about that? What's the difference for families who are like, okay, my baby can't tolerate milk, but distinguishing that from a lactose intolerance versus a cow's milk allergy, protein allergy?
Sure. Yeah, that's a toughie, but, such an important one to kind of start to tease out. So I would say, in infants, anytime you're going to see projectile vomiting after feeding, that's a concern to me. And I would say that child needs to be evaluated because, if that's it's coming out and going across the room, right? Yeah. It's different than a lot of spit up. And so, I will definitely say that some babies, especially, who may develop reflux, can still have fairly high volume spit up, but it is distinctly different than projectile vomiting. So projectile vomiting definitely needs evaluation. A lot of spit up, maybe the pediatrician can generally manage that. But yeah, I would say, when I see cow's milk allergy manifest, which sometimes we can even see it manifest with hives or, a rash that's a little different than eczema. So more of a pink, blotchy, raised rash that looks transient, where it kind of comes and goes and it migrates or whatever. And when it goes away, totally disappears and the skin looks normal. That's a rash that we generally refer to as hives, versus eczema, which is going to be also a pink or red rash. It can be raised and it definitely can be itchy, but usually it's going to kind of stay put for a while, until it's managed. And so, when we see a reaction like hives, a question I always ask myself is, what's the feeding history, right? So, sometimes we find that in the newborn period, when babies are exposed sometimes to cow's milk protein in a larger form, they may develop that early sensitization. And so sometimes, like, then later, as maybe mom's supply is dwindling for, if they choose to breastfeed and they start supplementing formula again, sometimes that's when we start to see reactivity. So we see that sometimes with cow's milk protein. We see that sometimes with soy protein, depending on what was in the, in the formula given in the newborn nursery or in the NICU even. So, sometimes we'll see that develop where we see that immediate type hypersensitivity. And that child definitely needs to be evaluated by an allergist and, and have a plan in place of what's the future of feeding for this child. Like, what do you do next and where do you go? Versus something like when we see lactose intolerance, which can definitely happen. And, I see patients all the time who, in their feeding history, they've like maybe started on one formula and then switched to a different formula and then switched to one that's like gentler on the GI tract. And then, there's lots of switches as we start to tease it out, and that's all okay. Usually with lactose intolerance, we're going to see a lot of lower GI symptoms. So just lots of differences in the stool, and sometimes like grunting with bowel movements and things like that. So generally we're going to see it coming out the other end, but it's going to be normal appearing stool. So, and then, this differentiates from any time that there's, blood found in the diaper. That's a totally different scenario. Okay.
Yeah. That's good. Well, thank you. That's also very helpful. And so one of the biggest questions a lot of people want to know too is, then when should you see an allergist? So like if the baby, this baby is like 2 or 3 months. I remember I was in training, they always used to make it seem like no testing was really valid until they were above a year. Is that still standard? And then
No.
Okay.
Yeah, no, that's a good question. I would say, any sign of immediate hypersensitivity should be evaluated at that time.
Okay.
Because we see it sometimes, and we will do testing on those children, typically with skin testing in the office, which is a really simple procedure. It's really, almost entirely a pain-free procedure. So, for moms out there thinking like, gosh, I don't really know if I want to have my baby tested, it's really just very, very minimal, epicutaneous, just tiny little skin prick, that babies don't even notice it when it's being tested. And that way we can identify, like, does this, like for cow's milk, for example, or soy protein, like, does this food need to be strictly avoided? Do we need to have an emergency care plan? Like, do we need to have a prescription for injectable epinephrine? So these are all, great questions that we want to find out at that time for the sake of the safety of the baby, so that's really important. And then I would say other, infants that I commonly see, there's kind of like two other groups of infants that I commonly see. One is babies who have blood in their diaper. So this is a different type of problem. And usually when the kids are otherwise asymptomatic and you like notice there's streaky blood in the stool and you're kind of like, oh, like what's going on here, right? So that is a very common immunologic problem with food. And usually we're talking again about cow's milk protein most commonly, or soy protein. And this is something that's called food protein induced proctocolitis, where they get totally asymptomatic, very lower GI bleeding from those foods. And the answer to that is to withhold them from the diet, but most children will completely grow out of it by the age of 12 months. And when we do allergy testing for that problem, it is negative because that is not immediate hypersensitivity. So it's a different immunologic problem with food. So I see those babies. And then I see the babies who have moderate to severe eczema that aren't improving with management that started in the pediatrician's office. Okay. And the reason why is because sometimes we see immediate hypersensitivity to, sometimes it's to food allergens, sometimes it's to environmental allergens like the family's dog or maybe dust mites within the household, that are contributing to drive the presence of eczema. And so depending on the severity, sometimes we, test some of the most common food allergens that may have already been introduced as the child's advancing with solids. And they may eat them and tolerate them fine, but it may be a contributor to why that eczema is so moderate to severe or resistant to treatment. So sometimes we'll modify the diet a little bit to be able to get that skin under better control, without necessarily having to utilize as much, topical anti-inflammatories and things like that.
This is so good. And I mean, so much so I feel like over the last, at least for me, 10 years or so, where people have come to realize how much of what we eat really can manifest in many ways, and in response to allergies. And I remember one of the things for why breastfeeding was recommended too was along with developing that immune system, but also the exposure of the variety of things too was
Sure.
thought to be good as far as preventing a lot of, like, I guess, allergic reactions later on to some things. And so is that still generally a good idea in terms of understanding, like, does more exposure to varied diets or things like that seem to be helpful in terms of longer term allergies, or not really?
It's hard to say, to be honest with you, but generally speaking, when we feed newborns and infants with breast milk, the, food proteins that they're getting are extensively broken down already. So, usually that's a good opportunity for their gastrointestinal tracts to develop immune tolerance, because, what happens immunologically is that when our immune system is kind of doing its normal surveillance, it's checking out all the stuff in our body to say, okay, is this supposed to be here? Is this mine? Or is this not self? And in the setting of things that are not self, then our immune system's kind of like, okay, well, this isn't me, but is it dangerous or not dangerous? And so what we want to happen when we get exposed to food is that as we get these broken down proteins through breast milk, we want baby's gut to say, okay, this is not mine, but it is not dangerous to me, and we need to build immune tolerance. And the best way to do that truly is through the gut. And so, this is why when we kind of look back to, many years ago, probably, when I was an infant, many years ago, goodness. And back then the guidelines was, to wait to do, solid food introduction of some of these, more profound food allergens. And so what was happening was we were starting to see that because we were delaying that opportunity for the gut to develop that immune tolerance, we were getting exposed, or babies were getting exposed to food allergens in other ways. Sometimes maybe we're talking about transdermal exposure, right? So let's say somebody is handling whatever, some kind of food protein, and has it on their hands and then holds the baby, right? That's a way that our immune system is maybe recognizing things for the first time. And in this case, right, it's not the gut. And so then we tend to start to see that major upswing in the prevalence of food allergy, through the years. And so, the pendulum has definitely swung back the other way. And now the guidance is to start introducing some of the more highly allergenic food, early. So, as early as, 4 months, and starting to get that food into these babies so that way they can develop their immune tolerance. But I would say overall, it's not 100% clear as to why some babies develop food allergies. That's $1 million question. I wish I had the answer, but but we know that it exists, and so we want to make sure we're very astute in identifying it.
Well, that's good. I think that's good for our parents to hear, and even like our professionals, pediatricians that are family doctors that be watching and are like,
Yeah.
should I send a baby sooner rather than later for an allergy evaluation, especially if it's something that's getting out of the scope of, okay, I've managed what I thought was going on and things are still not improving. That's a good time to consult an allergist, an immunologist, and see, is there something better that can be done to get that baby and that toddler on track? Are there things that, and so going back to, I just want to address this since we're going into allergy season.
Oh yeah.
With all the pollen, explain a little bit, and you may have said it too, but just maybe reiterate about like how seasonal allergies like allergic rhinitis and things like that are different from some of the other, because remember we say like a lot of people kind of batch all that together, like, oh, they're allergic to this and that and all of that. And like, so how is that different, like having allergies to pollen and things like that, or is it different?
Yeah, it's a great question. So there's a lot of similarities, I will definitely say, which is that you need to become sensitized before you become reactive, right? So in a child within the first year of life, parents ask me all the time, they're like, well, we go out for walks with the stroller. It's not enough. Okay. So like once your kid is climbing on playground equipment and spending hours and hours outside, that is when you're having real, true first exposure. And so when we see reactivity develop, usually around the earliest we see it to the environmental allergens outdoors is in that subsequent pollen season. So depending on the birth month of the child, that may be, around the age of 2 years plus or minus. So I'll give you a personal example. So it also depends on birth order too. So my oldest child, my son, is 9, and he has a December birthday. So, once he kind of was up and moving and climbing and all of that stuff, he probably was somewhere between 15 to 18 months before he was really starting to get that significant outdoor time, because when he started walking, it was winter, right? So we weren't doing that. And so, it really would have been until he was about 2.5 before, if he was going to develop environmental allergies to the outdoor stuff, that we would start seeing it. Indoor stuff will start earlier because that time of exposure is greater earlier. Now, my second son was born in August. So being the second child, the poor baby got dragged around to all of his older brother's stuff, right? So they get more outdoor exposure earlier because you're catering to the schedule of the older child. That's what we did anyways, because he had stuff to do. So we do spend a little more time outside. My second child had an August birthday. So by the time that he was really kind of out and about like a lot, it was actually before he was 12 months, and he was really spending a lot of time outside that summer. So it really would have been before he was 2 when he would have potentially started developing environmental allergies to the outdoor stuff. Interestingly, for him, it really started around the age of 6. So why is that? I don't know. Every kid's different. So yeah, but you have to be sensitized first before you can be reactive. So usually it's going to be subsequent pollen season.
And one last question I have for you, because this has just boggled my mind just personally, is how can you like be exposed to something and it be fine, and then like one day you're all of a sudden allergic? That just is like, does your body just decide it just doesn't want to deal with it anymore? Or what, because you'll have people like later on that really have a true allergy to something. Like I was always able to eat like seafood, and then that one time that was like, or I didn't have any problems as a child, but like now as an adult or older teen. So what is happening in the body at that time, and just to kind of ease people's minds? Because I find sometimes too, people try to justify like, well, I've never been, and then like that means that can't be a possibility, but it actually can be.
Well, that is a majorly loaded question. So I can give you like a 5-part answer.
Yes.
So,
yes.
Okay. So the first thing is that number one, symptoms are not always going to be the same. So often they may, we'll see a ramp up. So maybe, my son who developed his symptoms at 6, did that mean he didn't have them at 5 or 4 or 3? They probably were going to be more mild and less noticeable and less of an interference, with his life. And so, it's not that it wasn't there. It just wasn't a problem. So that's number one, is that there may be a ramp up in symptoms. Okay. For individuals who may develop problems later in life, like in, adolescence or their teenage years or in adulthood, often we find a change of exposure to make a big difference. So, we talk about like the polygenic inheritance of allergy, right? Children who have parents who have allergies are more likely to have allergies, but environment is a big part of that too. So, let's say you take a child who, grows up in the area where they, where they live in their hometown, and then maybe they go off to college, right? In another place, and they spend time elsewhere, and then they come back and all of a sudden their symptoms are dramatically worse, right? So this is, again, our time of that initial exposure and development of sensitization, and then our reactivity especially will escalate after a time of absence. Actually, I just saw a child, a young adult actually, who this is exactly what happened to him. Grew up in our town, went away to school in Florida, and then he came back for a spring break and he's in like dire misery because of his horrible allergies. So that can definitely happen. We can see this with families who move to different locations, or people, in the greater DC area, I take care of a lot of people who work for the government. They may go and live international for a couple of years and then come back to the States, boom, symptoms are worse. So that definitely happens. To kind of comment on the food allergy and development of food allergy later in life, which definitely does happen. I will say there's kind of two issues. So the most common is a problem that's actually a secondary form of food allergy that's called the pollen food allergy syndrome, or some people call this the oral allergy syndrome. And many people experience this, right? Which is a lot of oral cavity symptoms, itching, tingling, mild swelling of the lips, the gums, the tongue, the roof of the mouth, back of the throat. And we see this with a lot of fresh fruits and vegetables, nuts, seeds, and legumes. This is a problem entirely connected to environmental allergens to certain types of pollen, where there's cross-reactivity amongst the allergenic proteins. So just as that pollen allergy may develop or advance over time, about 40% of people with certain pollen allergies may develop pollen food allergy syndrome at any period of time. And usually we see that kind of later in childhood and into adulthood. Shellfish is a little similar and a little different, which this is so fascinating. So the allergenic protein in shellfish, this is a very common misconception or common, myth, which many people think the common allergen is iodine. It's not. We all need iodine in our bodies. We cannot live without it. Nobody has an iodine allergy. Okay. Now, you can have a contact dermatitis to topical iodine, and some people can have an allergic response or a non-allergic response that's still significant to radio contrast media, which doesn't include iodine anymore. Those are different problems. But shellfish, crustaceans namely, the allergenic protein is something that's called tropomycin. And it's a protein that's part of the exoskeleton of the crustacean. Well, guess who else has an exoskeleton that's made of tropomycin? Dust mites. Okay, so often we see that as shellfish allergy may show up later in life, again, this may be due to the fact that that patient also has substantial dust mite allergy, which may have escalated over time. Like, I know, right? It's like, and so yes, almost entirely we will see that correlation with dust mite allergy and with shellfish. And sometimes patients will say, look, it's inconsistent. Like, I have problems with shellfish sometimes, but I love it and I can really eat it. That is different than when we see primary shellfish allergy. Those individuals do not want to be within 100 yards of a shellfish. They're like, no, thank you, good riddance. I do not want it. That is their body protecting them from their primary food allergy to say, like, you just don't need to eat that. And so we kind of develop that sort of our own defense to say, like, not a chance, I'm steering clear. So very, very interesting stuff. That was a great question. I went in 100 directions there, but.
No, I love it though. These are all things that I'll be thinking about when I'm talking to people, and I'm just kind of wondering, like, and I'm just glad to know it's really that deep, because I feel like it is.
Well, I'll tell you what, it is the most rewarding and fascinating, especially I am totally biased because I love my career, but every single patient is different. I see patients from babies all the way up through the elderly, and it's different at different stages of life and different types of immune system problems. And every day is something totally different. So we have a lot of fun in allergy and clinical immunology. It is awesome. I'm biased, but it's awesome.
And I think this one question I will have, is there a mom? So a mom watching, and she might be like, sure. Oh, I have this new baby, or even a mom to be. Is there anything they can do to decrease the risk of allergies or allergic reactions when their babies are toddlers? Or is it kind of just like, you kind of live the life and see what manifests?
Yeah, you kind of just have to live it and see, but I would say, things that I would say would be important once baby arrives, if you've got a baby with eczema, take the baby to the pediatrician to get it, evaluated and to fix the integrity of the skin. When we lose that integrity of our skin as an immune barrier, we end up dealing with more problems. And so food allergy and eczema often go hand in hand. That is very, very common. One of the best things that you can do is moisturize your child, keep the skin nice and moist. And then if you really start to see problems of an inflammatory rash developing, which I see, I'm an allergist, but I see it all the time, bring the kid to the pediatrician and let the pediatrician help guide you in order to kind of, get things going in the right direction. And when that's not possible, get in to see an allergist. So, I think that that's just helpful because, as primary care providers, I think we sometimes feel like there's just not enough time to do all the things that need to be done. And so, it's great to utilize specialty care when we just need that extra TLC that, you know,
Yeah.
that can be done in a little longer visit with a little bit more hand holding sometimes. So we're happy to
Yes,
help.
good. Well, I think your patients have a gem in you for sure.
Aw.
And I see the passion radiating from you. And I'm glad that there's somebody out there that I can refer to when I have that question. Because see, if it's fascinating and interesting, different for you, definitely for me, who doesn't necessarily do it all the time. But
Right,
rashes are common to pediatric problems. I mean, that's
for
probably
sure.
like a third of visits too. Like, oh, my kids broke down to a rash, or are they vomiting or anything like that. And
Sure.
so we always have to say allergies should always be on your differential diagnosis. When,
Yes, ma'am. And I'm always happy to get that text message of the picture of the diaper to say, like, what's going on here? We've done that
yeah,
before.
hey,
It's all
hey,
good.
it's learning, and I definitely learned so much. That's why I wanted to have this topic to help my moms, because even since I've explored my own business, is kind of brought up all the challenges and concerns that moms have, like we have already alluded to. So, Dr. Kaufman, thank you again for coming on, and tell people how they can find you and follow you on social media.
Sure. So you can find me on Facebook at Kaufman Allergy. And I'm also on Instagram at Dr. Allergy. My practice is in the Washington, D.C. suburb of Vienna, Virginia. So for all of those who are in Northern Virginia who need an awesome allergist, come see me in the office. Our website is kaufmanallergy.com, and you can learn more about me and the services that we provide.
Yes, and I will put all of that in this post of this video. I will edit it, so it'll include all of that. And I'm Dr. Daigle, and I will be announcing the doors of my opening practice. Okay, so you guys tune in for that. I'll be announcing that date soon, but you can follow me here at Just Daigle on Facebook, and at @momandme_MD on Instagram. And I just, I'm behind people, but I'm getting there. I just started my TikTok account too. So I'm going to be sharing all kinds of little educational videos for my mamas, so that way they can defeat overwhelm and embrace their motherhood journey. So thank you again so much for this great information. I'm definitely going to be watching the playback on this one. And I hope that you all have a lovely Friday and a great weekend. And thank you, Dr. Kaufman.
Thank you. It's so fun. Thank you so
All
much.
right, you too. Bye.